Right, hey guys, this video will be focusing on the anatomy of the thigh. So as customary, we'll start with the skin, then we go all the way deep into the muscle. So we'll try combine it into anterior, medial, and posterior compartment. Then if you look at the skin, right, this is medial side, this is lateral, right? So you're going to have specific nerves that are going to supply the skin of the thigh. On the medial aspect of the thigh, you're going to expect to see three nerves. Higher up, you expect to see the femoral branch of the genitofemoral nerve coming from your lumbar plexus. That is responsible for the cremasteric reflex. You're going to tap the inner aspect of the thigh. Then you also expect to see the obturator nerve a little down, coming from the lumbar plexus as well. Remember L2, L3, L4, carrying the same nerve fibers as your femoral nerve. Then lower down, you expect to see the medial cutaneous nerve of the thigh, as well as the intermediate one, which supplies the anterior aspect of the thigh. Remember, the medial and the intermediate cutaneous nerves of the thigh, they're actually branches of your femoral nerve. So the femoral nerve will divide into an anterior branch and a posterior branch. The anterior branch will give you two cutaneous branches, that is the medial and the intermediate, and it will supply all the muscles of the anterior compartment of the thigh except the quadriceps femoris. Then those that are making up the quadriceps femoris will actually be supplied by the posterior branch, whilst you'd also expect the posterior branch to give you a cutaneous nerve known as the saphenous nerve, which is actually going to supply the skin on the medial aspect of the leg all the way up to the big toe. When you go to the medial aspect of the foot, to the ball of the big toe, or you just say the head of the first metatarsal, right? Then on the lateral aspect, the skin will actually be supplied by your lateral cutaneous nerve of the thigh, right? Then going a bit posterior, the skin on the posterior aspect of the thigh will be innervated by the posterior cutaneous nerve of the thigh, which in this case will be carrying nerve fibers S1 to S3. And these nerve fibers, they will actually also supply the skin of the buttock. If you remember the gluteal region, you're going to divide it into 4 quadrants, where the upper lateral quadrant was going to be supplied by the subcostal and the iliohypogastric nerve, whilst the upper medial was the only one that had posterior rami that were coming from L1 to L3, then S1 to S3. And if you look at the quadrants, the lower quadrants, the lateral one was innervated by the lateral cutaneous nerve of the thigh, whilst the medial one was innervated by your medial cutaneous, rather the posterior cutaneous nerve of the thigh. Right. Then to describe the muscles of the thigh, in a way, you need to compartmentalize the muscle so that they do not bother you much. So the easiest muscle to identify is this muscle here, which is your sartorius muscle. The sartorius muscle will be the longest muscle in the body, and it forms one of the pes and serinus muscles, right? So you're going to have that sartorius originating from the ACES, anterior superior iliac spine. Notice that is where the inguinal ligament is also attached, right? Then if you look at its insertion, it inserts onto the upper medial aspect of the tibia, together with the 2 other muscles forming your pes and serinus. So you'd expect the gracilis muscle from the medial compartment of the thigh, as well as your semitendinosus coming from the posterior compartment of the thigh, right? Then still in the anterior compartment, you're going to see the quadriceps femoris. But from this view here, we can only see the superficial muscles. So this is the rectus femoris, which forms part of those muscles, the quadriceps. Rectus femoris will be having 2 heads, a long head that comes from the anterior inferior iliac spine, which also provides attachment for the iliofemoral ligament, which is one of the ligaments that stabilize the hip joint. Then the other head, the reflected head of your rectus femoris muscle, will actually be coming from the acetabular surface of your hip bone. Right. Then you're going to have the vasti muscles, vasti lateralis, vasti medialis. If I rewind a little bit back to the bony anatomy, you'd expect that these will actually be the origins of those muscles, vastus medialis, vastus intermedialis in this region, and that is going to be vastus lateralis. Right. And remember, both the vastus lateralis and the medialis towards the knee joint, they're going to form what are known as retinacula that will actually further strengthen your knee joint, whilst the vastus intermedialis will actually form part of that articularis genu that will also form part of the stabilizing factors of the knee joint. Right. Then in this region here, this is going to be the pectineus muscle. Right. The pectineus muscle is a composite muscle. It's going to be innervated by the nerve of the anterior compartment, which is your femoral nerve. It's also going to be innervated by the nerve of the medial compartment, which is going to be the obturator nerve. So this is the pectineus muscle. Right. Pectineus, it will come from the pectineal line of the hip bone and will actually insert onto the pectineal line of your femur. Right. Then if you look at these muscles, right, you have the psoas and you have the iliacus. When we eventually describe the anatomy of the femoral triangle, we'll see that these muscles will actually form part of this gutter-shaped floor. Right, and coming from laterally, you expect to see the iliacus. Remember, the iliacus was coming from the iliac fossa. Would expect to see it on the posterior abdominal wall. The psoas major is also coming from the posterior abdominal wall, and they both insert via an iliopsoas tendon onto the lesser trochanter of the femur. Right. Then other muscles that you expect to see on the anterior aspect, this is now the adductor muscle, the adductor longus. It's the muscle of the medial compartment. And remember, the thigh is enclosed by a fascia or a deep fascia that like a sleeve, right? And you're going to have fascial septa that are going to extend inward to divide your thigh into 3 compartments. So it's a bit homologous to the arm. And the arm, if you look at the arm, anatomically we describe it to have an anterior compartment and a posterior compartment. But the coracobrachialis muscle actually represents a degenerated medial compartment of the arm. Right, but those compartments are still 3 when you're looking at your anterior compartment and the medial and the posterior in relation to the thigh. And to take you a bit back to embryology, when you did development of the upper limb, you say that they were going to rotate 90 degrees lateral, whilst the lower limbs were actually going to rotate 90 degrees medial, meaning to say the muscles that you find on the anterior aspect, you'd expect those muscles to actually be extensors. Different from what you saw in your upper limb when you say that the muscles that you actually expected to find on the anterior compartment were going to be flexors, right? So these muscles, with the exception of the sartorius, which I'll describe a bit later, these muscles, if they cross the knee joint, that is the anterior compartment muscles, if they cross the knee joint, they're going to extend it. If they cross the hip joint, they're going to flex it. The only weird one will be the sartorius muscle, which is going to flex both the hip and the knee joint. Another muscle that you're going to see in the lower limb that is going to have the same action on both the hip and the knee joint is going to be your gluteus maximus muscle, which is actually going to extend both the hip and the knee joint. It's going to extend the knee joint via the thickening of deep fascia on the lateral aspect, which is your iliotibial tract, as is in this case. Right. Then going a bit posterior, this is going to be the gluteus maximus. I will describe that in the video of the gluteal region. Then if you go a bit down, right, these are going to be the muscles that you expect to see in the posterior compartment of your lower limb. So you're going to have this muscle here. This is going to be your semitendinosus. This is going to be the long head of the biceps femoris, right? Remember the biceps femoris. It's the only one on the posterior compartment that will actually be going to the lateral aspect. The semitendinosus and the more deeper semimembranosus in this region will actually be coming onto the medial aspect of the thigh. Then another muscle that you expect to see in the posterior compartment is this adductor magnus. This adductor magnus will have an adductor portion which is part of the medial compartment, and it's also going to have a hamstring portion which is part of this posterior compartment. Most of these muscles, they originate from the ischial tuberosity. Of course, the biceps femoris is going to have two heads, so you'd expect the long head to come from that ischial tuberosity, whilst the short head will actually originate from your linea aspera. Then the rest of the muscles, they're coming from the ischial tuberosity. And the hamstring portion of the adductor magnus is actually coming from the ischial tuberosity as well. And if you look at those muscles, you'd actually expect them to have the same innervation being your sciatic nerve, but particularly the tibial portion of the sciatic nerve. It only differs for the short head of the biceps femoris, which is innervated by the common peroneal portion, right? Then these muscles, being flexors, they're going to flex the knee joint. Right. So they're going to flex your knee joint. But remember I said, if it flexes the knee joint and it so happens to cross the hip joint, it's going to extend it. Right. So you'd expect muscles like your semitendinosus, your semimembranosus to actually extend at the hip joint, as well as the long head of the biceps femoris. And these are still the anterior compartment muscles. Here we have exposed the vasti. This is vastus medialis, lateralis. This is intermedialis. Intermedialis will actually be beneath. This is still the rectus femoris. Notice how you have a long head and a short head. Right. And also remember that the insertion of the vastus medialis is more extensive, and the lower fibers are almost horizontal to sort of like prevent dislocation of the patella, because the patella has a tendency to actually dislocate laterally rather. So you need the medial fibers to sort of like pull it back inward. Then this we have reflected the rectus femoris. We can now identify the vastus intermedius, which is this one in this case here. Right. Then if you go to the medial compartment, just like the posterior compartment, these muscles are going to be coming from the inferior ramus of the pubis. So pectineus, remember I said it's also part of the anterior compartment. Adductor brevis, adductor longus, gracilis. Then you have the adductor magnus, which we also say it as a hamstring portion, which makes it also a part of the posterior compartment of the thigh. These muscles are coming from the inferior ramus of the pubis. Remember, the adductor magnus also has an origin coming from the ischial tuberosity, because it's actually part of your hamstring muscles, right? Then the gracilis muscle, together with the semitendinosus and the sartorius of the anterior compartment, they're going to form what is known as the pes anserinus. And these muscles, they actually insert onto the upper medial aspect of the tibia, right? Gracilis, sartorius, semitendinosus. Right. Then the adductor longus inserts onto your linea aspera. Same applies with the adductor portion of the adductor magnus, but its hamstring portion will actually go to the adductor tubercle. Right. Then these muscles are innervated by the obturator nerve. Right. Remember, the obturator nerve was actually emerging on the medial aspect of the psoas major as a branch of the lumbar plexus, carrying the same nerve roots as the femoral nerve L2, L3, and L4. Right. Then higher up, you also expect to see this muscle here, the obturator externus. We met the obturator internus when we were doing the lateral pelvic wall. This is now the obturator externus. So it originates from the outer surface of the obturator membrane, right, as well as the inferior pubic rami, where the other adductor muscles are actually coming from, right? And it's going to insert onto the medial surface of the greater trochanter. So just like the other lateral rotators of the hip, where you also had the obturator internus forming part of that group of muscles, this muscle will also insert onto the greater trochanter of the femur. So what is going to the lesser trochanter is actually the psoas major and the iliacus muscle. Just like how if you translate it back to the shoulder joint, you'd expect to see the greater tuberosity in having insertion for the supraspinatus, infraspinatus, and the teres minor, whilst the subscapularis will be the only one that will go to the lesser tuberosity, right? So these muscles, they adduct the thigh at the hip joint, and they're going to flex the knee joint, as is the case of the gracilis, because it crosses the knee joint, right? Then the adductor longus will also laterally rotate, right? And these muscles, they're actually known as the custodians of virginity, because if you're going to adduct, you're actually going to keep the thighs closed, right? Then the obturator externus will also laterally rotate the thigh. So it's also a small lateral rotator. So topographically, it's more or less part of this compartment, but functionally, it's part of the deeper muscles in the gluteal region, which are lateral rotators, to include the piriformis, obturator internus, gemelli superior and inferior, as well as the quadratus femoris. Never confuse quadratus femoris, which is a small lateral rotator of the hip, with quadriceps femoris, which is an amalgamation of the rectus femoris, the vasti lateralis medialis, and the intermedialis. Right.